Hi, everyone. Welcome to the Spine Health Foundation. I'm your host, Erica Anderson, today for our monthly Facebook Live interview. And I'm so excited to welcome Dr. Tom Walters of Rehab Science to speak with us today. Thank you so much for joining us, Dr. Walters.
Totally. Thanks for having me. I'm excited to be on, and the spine is a huge passion of mine. So excited to chat about it a little bit.
Yeah, it's kind of like anything you do within healthcare and specifically physical therapy, obviously very connected to the spine. And so we're so happy to be talking with someone today who's done some great work in that area with so many people. Before I jump into all of my inquisitive questions, I would just love to hear a little bit about you and sort of your professional background and what led you to where you are today.
Yeah. Okay. Perfect. Yeah. I've been a orthopedic physical therapist for 13 years now. It seems like it's gone really fast, but I originally, did my undergrad in exercise science. I'm from Montana, so I did that at Montana State University, and then I went on and did the DPT, the Doctorate of Physical Therapy, in Southern California, and finished that in 2007. And then when I got out of physical therapy school, I pretty much have spent my whole time. I really had a passion for orthopedics the whole time. So, and especially, I really started out in the beginning in manual therapy. So I did a residency in orthopedic manual therapy. So I really used my hands a lot to work on people, and then pair that with exercise. And we can talk more about the evidence around those things as we go. But I still kind of integrate those things quite a bit. And yeah, over the 13 years as a PT, I've been in orthopedics pretty much the whole time. Different, sometimes outpatient orthopedic clinics, smaller clinics. I've done a little bit of traveling physical therapy around the U.S. I was a PT for Cirque de Soleil for a while. And really the last 8 years, I've run a cash-based PT clinic, and I've taught full-time as a kinesiology professor at a small college in my town of Santa Barbara. So I just left that position a year ago. So really, I'm kind of back into full-time clinical work and doing a lot with Rehab Science and sort of online physical therapy, which sounds a little strange, but yeah, that's
Well,
kind of
these
my
days,
background. Yeah,
these days it
exactly.
doesn't sound strange.
Totally.
So I would love to just hear sort of what gave you the passion to pursue this career because it seems like something you really love, and it's so great when you get to actually do something that you love for your career. So what gave you the desire to pursue this pathway?
Yeah. Yeah, it's interesting. I love it more now than I did when I got into it, and I liked it back then. But I think, like a lot of people who are a lot of other physical therapists I know, I was an athlete, in high school and before that, and I had surgery, went through knee surgeries and things, and went through the rehab process. And I think that introduced me to it at first. And then when I was in college, I really was just really sort of became obsessed with anatomy and physiology and that sort of academic content. So I was really looking for a career that would sort of tie my athletic background with anatomy and physiology, and also allowed me the balance to pursue other life things that weren't just purely academic. So
Hmm.
PT school was a good fit for me rather than medical school and other things. So yeah, that's kind of how I got here. And I mean, I love it. I think people get that sense from what I do on social media and things because, I just love talking about it. I love educating. I think, just I love seeing people who are in pain get better. And I think, and education is such an important part of that. So yeah, it's just I've like you said, I feel very fortunate to be doing the thing that I'm so passionate about.
And so quickly, I was going to ask you about Cirque du Soleil, but you brought it up already. So tell me how that worked. Like, how did you get that job and how cool of a position to be able to take?
Yeah, it was a really awesome position. They have on each of their shows, they have resident shows and traveling shows, and each one has around three sort of rehab practitioners, a combination of athletic trainers and PTs, and so it's a pretty extensive, challenging sort of interview process. I think it was around a 3 hour interview, something like that, and they really look for people who have backgrounds in sort of both acute sort of um, on-site sort of medicine like an athletic trainer would normally possess, and then my background in manual therapy was attractive to them. I didn't actually have much of the athletic training background, but yeah, I went through this interview process, and it was a really just a cool position. I spent part of the time in Vegas, and then I really was hired for a show that was in LA for a while. So I went to Montreal to create all their shows there. So I treated the performers. Our show was called Iris. It was a history of cinema. So it came to LA, and
Oh, cool.
but it had mainly dancers, former Olympic gymnasts, trampolinists, and we basically the performers would just sign up for treatment, and they could get worked on every day, however much they wanted, and we just basically kept them healthy and were there at shows in case something were to happen. So yeah,
That's really
really
cool.
neat position. So yeah.
Yeah, that is really neat. Well, I want to transition to sort of what you're doing now, which is Rehab Sciences. I don't know if that's just one of the things you're doing, but I would love to talk about, in terms of your patient demographics, what are some of the main problems people are coming to you with? What do you see most often?
Yeah. The demographic I see, just for your listeners, I think will fit most people. I tend to see adults, and I mean, some maybe high school kids, but it probably is in that, sort of 30 to maybe 70 age range, and people with just sort of more common aches and pains, orthopedic type things. But I think when people come to see me, the most common issues that we end up seeing are like the spine pain, so low back pain. I think most of us know now how common low back pain is, and so I see a lot of low back pain, neck pain, lots of pain at the front of the knee. We call it patellofemoral pain. Lots of rotator cuff, what people used to call shoulder impingement. So those Achilles tendinopathies, tennis elbow, things like that.
Mm-hmm.
So really common, and I think that's why my social media work is popular, because it's addressing conditions that are so common throughout the population,
Yeah.
so, and around the world. So
Now,
yeah.
do most of these conditions, are they related to injury, or are they more just, sort of things that happen with age or genetics?
Most of them, I would say, are most of the people that I'm interacting with and seeing are less. They're not usually traumatic things. I mean, there are some of those where someone has a real acute trauma, but most of the time they're more sort of, you might think of as sort of the repetitive overuse type conditions that are associated just with the time of doing something, or maybe with people not moving a lot and maintaining sort of static postural positions. And so they tend to be conditions where we're not really so much worried about some tissue being damaged, but the person has pain, and it's trying
Mm-hmm.
to work through the complexity of pain, especially when you get into the spine. Pain can be so complex. So so it's more of that kind of stuff, kind of maybe overuse, repetitive kind of pain conditions.
Mm-hmm. Yeah. So, a lot of times when we're talking with people, we want to get sort of some basic information. So you obviously know a lot. You're a professor, you're a doctor. But in terms of sort of some of the basic tips you might give someone in terms of prevention of getting those injuries, and then B, in terms of recovery. And once you have one, how do you smartly do that process of recovering?
Yeah, for sure. Yeah, I think, we always try to talk about reducing the likelihood of injuries, because prevention is never foolproof. You can't fully prevent something. Things just
Right.
happen. You trip off a curb and sprain your ankle. It's hard. You can do everything out there and still have an injury, but there are a lot of things you can do to help reduce your likelihood of injuries. And, I think the big ones, are going to be things that I'm glad to see being talked more about in the research now, but things like adequate sleep. I think the sleep issue is coming up a lot, and we've seen lots of studies in athletes where reduced sleep reduces their musculoskeletal performance and increases their risk of injury. So that happens in the normal population too, but things that maybe people wouldn't necessarily associate with physical therapists like me, but sleep, thinking about the person's nutrition, and maybe getting the right sort of breakdown of macronutrients. Am I thinking about are maybe some of my things in my diet pro-inflammatory? I think we're seeing more and more talk about just inflammation in the body, and how can we, especially when you think about pain, if it's a trauma like spraining your ankle, maybe those things don't matter as much. could on the recovery side and healing. But when it comes to just non-specific pain, I think considering the inflammation in your body and how that's affecting your nervous system is really important. And then exercise, just basic general exercise. It doesn't have to be really complicated. Sometimes with the spine, for instance, people are always talking about these really complicated core exercises, and really just basic walking in many cases has the same evidence for really complicated core exercises. So, and we see more and more research with aerobic exercise. So if people can jog or cycle or swim, sustained aerobic exercise helps to reduce inflammation in the body. So that, I think can have an effect on pain and things and recovery. So, a lot of those things are both reducing the likelihood of having pain or an injury, and also would help on the recovery side of it. I talk a lot in my account, if somebody does have a musculoskeletal injury, the evidence is usually best for resistance training, better than stretching, better than balance work, and those things can play a role for sure. But resistance training, where you're lifting a load, maybe it's body weight, that type of exercise tends to have the best evidence for reducing injuries in the musculoskeletal system. So you can kind of think of it as if you're lifting weights, and it could be bands, dumbbells, whatever it is, that resistance improves the capacity of your musculoskeletal system. So your tendons get stronger, your ligaments, the discs in your spine, your bones, and if all those things are stronger, you're less likely to suffer an injury.
Yeah, and it doesn't need to be, I mean, correct me if I'm wrong, but it doesn't need to be, you don't need to be lifting, 30-pound weights on each side. Like a small amount is good enough, right?
Yeah, and I think that, we used to think more along the lines of it had to be really heavy, and we're seeing more now that resistance training can also be effective. If you have a lighter load and you just do more reps, you also can increase, the capacity of your tissues too. I think we tend to try to get people in finding a weight that they would get tired somewhere in the maybe 8 to 15 repetition range. That seems to, across these different studies, that seems to be a good amount. You get tired in that range, you have a load that's sufficient enough to really increase the strength of your tissues.
I just lost my train of thought, but I'm going to get it back.
That happens to me a lot.
Yes. I was just going to say, I had a question on the tip of my tongue, but I'm going to move on to the next one because I can't remember it. Oh, yes, this is it. Got it. In terms of listening to your body, so much like you're saying, like walking, basic stuff is really, sleep, hydration, all of these things are so basic. And yet a lot of people maybe don't do them or avoid them and don't realize that. And one of the most important things I've been told or understand that we could do is listen to our body. So can you talk a little bit about the importance of listening to your body, and how do you listen to your body?
Yeah, that's a great one. I think there's so many people that are just not really aware of what their body's telling them. And I mean, I'm not perfect at it either. I think it's a constant sort of evolution. And, for me, for instance, I've recently come to realize, I've really spent more time recently sort of paying attention to my sleep. And for a bit of time, I was using one of the wrist trackers and looking at how it was affecting sort of my recovery and things like that. And alcohol, things like that, like just how much alcohol would impair my sleep. And so, I'm evolving too and sort of paying more attention to those things. And I'm 38 now, so I am thinking maybe it's getting older. I realize I need to pay more attention to my body doesn't recover as well as it used to when I was 25. So, I think, a lot of times for me, and maybe this helps other people, I like to think of it like my body's an experiment. And so there's a lot of variables in life. And so it's not easy to control all the variables like an experiment like scientists would do. But I think we can take one variable in life and manipulate it and change it a little bit, just change one at a time, and see how that affects how you feel and your performance and things. Because really our perception of how we feel, I think a lot of times is a good indicator of how we're doing and what our health is like. So, maybe you manipulate your sleep by an hour. You add an hour of sleep and you do that for a week or two and just sort of track. And I think sometimes a journal can be really useful because these changes are slow and gradual. And we all know if there's something really gradual, you might not notice the day-to-day changes, but if you look back 2 weeks or a month, we do this with pain all the time because pain can change really slowly. And,
so true.
So I think thinking about your body and your health is an experiment. I mean, not being, that might sound a little weird, but you're just manipulate
No,
a
it makes
variable and change
sense.
it in sort of small doses. And then, yeah, see how, and then if you journal that and kind of pay attention to it and just see, like I say, we do this a lot with pain. We'll change one thing. We don't want to change too
Hmm.
many because we don't know what's happening. So you change one and just
Right.
kind of track that over time and get an idea. So I kind of look at myself that way. And I talk to patients about that too, that even me working with them, I'm trying to figure out how they're going to respond to what I'm doing. And that's always an ongoing experiment. So we just have to track it and modify as we go.
Yeah. Well, like you at the Spine Health Foundation, like we are very committed to offering people hope from the freedom from their pain. I mean, because so many people, it's like 100 million people in the country suffer from back and neck pain. And that sounds like it's a goal of yours as well. So have you met people that sort of were at their wits' end and sort of felt like, I don't know what else to do. I feel like this is never going to go away. Have you met those people and been able to help them?
Yeah, for sure. I mean, there's people like that all the time, especially when you get into these persistent and chronic pain conditions, which our healthcare system, honestly, if you look at the data, is not real great at treating. Persistent, we used to call them chronic all the time, but we use this word persistent more now. But persistent pain conditions are really challenging. And, so you meet a lot of people who have been to multiple different providers. I mean, there's probably people that'll listen to this that can identify with that, but they aren't getting places, and they're really struggling and down and depressed and fearful and scared about it. And I think what I'm seeing more of, and I think this is where physical therapy and rehab is changing a little bit, is that we're looking at pain more now from a biopsychosocial standpoint. And, you know, physical therapists are moving in this direction of, especially something like low back pain or neck pain, thinking about that pain less as something about the tissues of the body, even though that's the biopsychosocial, the bio is really important. We have to think about the tissues, and maybe there's a sensitive tissue. But we know from the research that if pain goes on past 3 to 6 months, it's less likely that that pain is due to a tissue in the body, because most tissues heal in that amount of time. So we have to start thinking about psychosocial factors. And, I think people, back to your point of sort of being aware of your body, I don't think most people are truly aware of how much their thoughts and emotions can affect their
Mm,
physical body.
yeah.
And I know for me, for instance, I have a sort of area of pain in the right side of my sort of mid thoracic spine below my shoulder blade, that if I get stressed out, it's triggered by psychological things.
Mm,
If I'm stressed out, that area begins hurting. And it's only because I think about pain so much and I'm studying it and talking to people about it, I think I'm aware of this. So I have sort
right.
of a leg up a little bit. But I know that thing is triggered by psychological pain, and then it's exacerbated by mechanical things, like if I'm doing the dishes or vacuuming and it's already flared up, those things will make it worse. But it
Hmm.
it tends to, so I think getting people to think about what are the things in their life that may be causing them some emotional distress, or maybe they have, we sometimes we talk about thought viruses. Maybe they've, you hear people say, oh, my dad has a bad back, so I'm going to probably have a bad back. And I think there are these beliefs that sometimes get passed down from family members or from your peers or what you read on the internet, and those beliefs can play a huge role in how you feel. And
Hmm.
I think we as therapists, we are constantly trying to help people in a sort of non-threatening way challenge those beliefs and change the way they view their body, uh, and sort of move out of those belief patterns. And it's hard. It's really gradual and slow. And so I would, I think that's, maybe people can think about that when they're stuck at home. Maybe they're not
Yeah.
able to sleep providers right now. Be careful what you hear from friends and family, what you read on the internet. There's a lot of nocibic things out there, where it's the opposite of placebo, where something you read or hear can actually cause you physical harm. And I spend a lot of time looking at the nocebo and that effect on people, and really trying to put out messages online that are positive and encouraging and help people, because there's a lot of those nocibic messages. So I think people just have to be careful what they're reading, and just know that it's complex. Pain is really
Yeah.
complex, and
Really.
everybody's different. And yeah, so
Yeah.
anyway, that's a long answer.
Well, no, I think that's such a good point though, because there's obviously no quick fix. It's not
Mhm.
black and white with the body. And unfortunately, part of the process is trying different things, going slow, and having a well-rounded approach. And I think maybe people don't realize that at first, but if they can be sort of mentally prepared, okay, like I'm going on a journey and these are the things I have to think about. I think that can make it sort of more successful just to have that in mind as they begin this process of trying to relieve their pain. Well, it is obvious that you love doing what you do. And I did want to ask you one question just about your online community. Obviously, it's thriving. You're providing so much great information to people every day on Instagram and Facebook, probably also Twitter, and who knows what, YouTube, all the places. So how did you build that community, and why do you love sort of cultivating it and being a leader in that space?
Yeah, that's an interesting, I spend most of my time on Instagram, and that's really where it started. And it was sort of by accident. I didn't ever think it would turn into what it is. I feel really grateful that, for where it's at now. But when I was teaching kinesiology, this is my third time with this account, and I had erased it twice in the past. And
Oh, wow.
I came into class one day, and a student came up to me and said, my mom has this rotator cuff pain, and you had a post it, and she was doing exercise that was really helpful, but I don't see it anymore. And because I deleted the account. So I left class that day and just left with the plan that I was going to try to provide something that was helpful to people and do that every day. And I'd been at that point, I'd been practicing 10 years. So I had sort of a good working idea of what the most common orthopedic conditions were. And I was just going to address those in as much detail as I could in a social media post every day. And that was in December of 2016. So, it's been going for a while now. And I just, I think it's so neat to me to be able to see people come into something like Instagram or whatever, somewhere on social media, and see a post, read a little bit, gain a little bit of education, and just do some basic exercises. Exercise has the best evidence for musculoskeletal issues. It's better than manual therapy. All these other modalities that you see sometimes in PT clinics. Exercise and education have the best evidence, and you can do those things on your own if you're motivated to do it. And so I think it's just been really neat for me to see that, and it works worldwide because I end up interacting with people around the world who don't have access to providers, or they can't afford it, but they have a phone and they can do exercises. And I think, it just that motivates me, and I really enjoy the interaction with people and just hearing stories of people doing these. I'm obviously not evaluating them, so I'm just trying to give sort of information that's general, and it's really neat to see that general information help people.
So did you build it up yourself? Like, did you just start using hashtags and it just sort of spread like wildfire?
Yeah, exactly. It's all been just organic. I just
Wow.
I was using a lot of hashtags. I think that like so many things in life, I was in the right place at the right time. I probably was only the fourth or fifth PT at that time who was really working hard on it. I just didn't know.
You led the way then, because there's a lot now. There's a lot of people out there on Instagram that have really large followings in the physical therapy community. I didn't realize that until I started working with the Spine Health Foundation. And as I started researching, I was like, people are looking for stuff on here. It makes sense though.
Yeah. It makes you realize how big of an issue pain really is.
Absolutely.
Pain injuries. If you look now, there's hundreds of PTs doing this. So it's, it was really just probably a handful in the beginning. And I think it was just valuable information, and I was in the right place at the right time, because really what I'm putting out there, people think that having a large following means you're really special. It doesn't really. It just means that I just like what I'm doing, and I'm consistent about putting information out. I think right place at the right time. And it's all these factors kind of coming together. It's not like the material's really this mind-boggling. It's just kind of traditional orthopedic PT. So,
well, it's good. You're obviously putting it out there in a way that people can really comprehend and utilize in a fashion that works for their lives. So, Dr. Walters, thank you for joining us today. We appreciate your insight and your information. I'm so glad we were able to make this happen, and we hope that we can keep in touch with you. And everybody, visit rehabscience.com for more information on what Dr. Walters is doing.
Awesome. Thanks so much, Erica. It was great to be on. Thanks again.